Vivian Dorsett, online speech class.
Good evening. My name is Dave Maldonado, and I'd like to provide you with some information about CPR. Now then, have any of you ever been in the living room conversating with one of your relatives, and as the time progresses, naturally you get thirsty? So you walk over to the kitchen to get yourself something to drink. Meanwhile you're in the kitchen, you hear a loud strange sound coming from the living room. So you drop everything, and you rush back to see what happened. Well, when you arrive, you find your relative laying flat on the ground, unconscious and not breathing. Scary, right? The American Heart Association reports that 70% of Americans would feel helpless to act during a cardiac emergency. But the terrible part is that 88% of cardiac arrests occur at home. So today, I'd like to provide you with some information about what CPR is, how to assess the ABCs of CPR, which stands for airway, breathing, and circulation, and how to actually perform CPR. Now then, according to the Orange Book, cardiopulmonary resuscitation is used when a person is unconscious, not breathing, and has no pulse. This exercise consists of compressions and ventilations at a 30-to-2 ratio, 30 compressions, 2 ventilations. The purpose of compressions are to pump the blood back into the most vital organs, which are the heart and brain. The purpose of ventilations is to oxygenate that blood. Now, every second counts, because if a person is not breathing within 6 minutes, brain damage will occur. And if left untreated, it will become permanent and possibly even fatal. And now, although time is of the essence, the very first thing you do in any emergency is call 911. Now, you leave them on the phone, and then you begin to assess the ABCs, that, at least according to the Pre-Hospital Emergency Care Book by Pearson. Now, I'd like to demonstrate how to assess the airway, breathing, and circulation, the ABCs. The very first thing you want to do is get near your patient, and you've already established that they're unconscious and not breathing. So the next step you want to take is you want to make sure they are in supine, which is flat on the ground, such as you see here. You want to make sure they're flat and on solid ground. Now, the way you assess the airway is you're going to tilt their head back, you're going to lift their chin, and you're going to look inside for any food, secretions, vomit, anything that's clogging the airway. The next thing you want to check is the breathing. The way you look at the breathing is you look, listen, and feel. The way you look is you're going to have to put your ear next to their mouth. You're going to look for chest rise. There is no chest rise. Then you want to listen. You're trying to listen for sounds of breath. I'm not hearing any. The next thing, you want to at least try feeling the humidity from their mouth as they exhale. Well, I'm not hearing anything. So, you report your findings to the 911 operator, and then you report to them that you're going to begin CPR. Now, according to the Orange Book, the Emergency Care and Transportation of the Sick and Injured, there are a few steps that you want to take for CPR, and I'd like to demonstrate them for you. Now then, we've established that the person's unconscious, not breathing, not responsive. So we've already assessed the ABCs. Now we're going to take 2 breaths. Each one should last 1 second. You open the airway. 2 breaths. You're going to check the pulse with your middle and your index finger, and your middle and index finger only, because your thumb has its own pulse. So these 2 fingers only. You push down firmly, no pulse. If there's no breath and no pulse, we're going to begin compressions. Now, It's going to be one hand on top of the other. You're going to use the heel of your hand right in between the nipples on the sternum. 30 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now, if you notice, my shoulders are vertically above my hands. My elbows are locked out. You push down about 2 inches at the furthest. You might hear a cracking sound when you push down the sternum, but that's normal. And you're going to do the 30 compressions within 20 seconds. You count out loud so that you don't forget what number you're on. You're going to do this for 5 cycles. You're going to do 30 compressions, 2 ventilations for 5 cycles. And then you're going to reassess the pulse. And you're going to continue that until either the paramedics arrive or the person has been resuscitated, meaning they are alive again and breathing. Now then, I thank you for this opportunity to let me introduce to you a new skill. I am confident that you will all know what to do in case of any emergency. Today I have spoken to you about what CPR is, how to perform CPR, and how to assess the ABCs, airway, breathing, and circulation. Thank you for your time. My name is Dave Maldonado.
Let me do a Spanish version.